On a bad day, my symptoms would be that I couldn't really do much of anything. I was just tired all the time. And if I did attempt to do something, I was usually out of breath very quickly.
For Deborah Dunn of Wentzville, her quality of life suffered greatly because of a heart problem with her mitral valve, called mitral valve prolapse. This condition occurs when the flaps of the mitral valve don't close tightly, allowing blood to leak from the ventricle back into the atrium. As a result, Deborah didn't have much energy for the things she loved, including painting and spending time with family. Early this year, she got the news. Her condition had deteriorated and surgery was needed.
It's scary. It's a very scary thing. I guess I never thought it would come to that, but I had been told it would, eventually.
Deborah was referred to cardiothoracic surgeon Dr. David Teodoro at SSM DePaul Health Center. Dr. Teodoro is a national expert in minimally invasive heart valve surgery, meaning surgery done through very small incisions.
The traditional surgery from an approach perspective is about an 8 to 10 inch incision directly in the middle of the chest. The breastplate or sternal bone is then divided in half with a sternal saw. We'll compare and contrast that to the minimally invasive approach. Much smaller incisions are made, and there's gentle spreading of the ribs to gain access to the heart, but that's vastly different from an overall stress on patient when compared to the full median sternotomy.
And he said, you just have to remember, this was still open heart surgery. We had you on a heart and lung machine, everything that would be done if we had cut you down the middle. And he said, but it's just that the recovery is going to be a lot easier.
Dr. Teodoro has worked alongside some of the true pioneers in minimally invasive surgery. He is well known for direct observation minimally invasive surgery and was the first in St. Louis to use the cutting-edge Vinci robotic surgical system for mitral valve repair. He chose the robotic technology in Deborah's case.
It didn't matter to me whether they used a robot or he went in and did it, as long as they fixed it and it could be fixed right. But I'm so glad the robot was there.
To watch the Da Vinci in the operating room is to be awed by the interface of man and machine. The surgeon sits behind a console and guides the robot through the intricate surgery.
The Da Vinci robotic system is an excellent piece of technology that aids in our delivery of minimally invasive surgery. The magnification is 10 times that of the normal human eye, and the surgeon is seeing the operative field in 3 dimensions.
The robot is used to access and repair the heart valve, going deeper than human hands to sew stitches during the surgery. The robotic arms move in sync with the skilled hands of the surgeon.
My ability to do what I need to do is actually enhanced, and the patient's ability to return to normal activity is very significantly enhanced with minimally invasive surgery.
Dr. Teodoro explains why minimally invasive is his method of choice for mitral valve surgery.
This is how the heart sits in the chest, and the mitral valve is more of a structure in the back of the heart. With minimally invasive surgery, the surgeon positions himself and the incision so as to access directly the back portion of the heart, and we then come in on plane with the mitral valve.
The Da Vinci robot can help surgeons avoid mitral valve replacement. Dr. Teodoro says repair is preferable to valve replacement, and it can be done 80 to 90% of the time. If a valve does require replacement, a mechanical or biological valve is used to replace the faulty one. Aortic and tricuspid valves are also being repaired or replaced using the minimally invasive approach.
When patients are diagnosed with a valvular problem that has risen to the level of surgical intervention, those patients, if left untreated, will develop very predictably worsening congestive heart failure.
It just amazes me that much can be done and that I can feel this good. Such an improvement over what I did feel before I went into the hospital, and all he did was make that little incision.
Other benefits include reduced pain and post-operative discomfort, reduced need for blood transfusions, shortened recuperation and rehabilitation time. Today, Deborah Dunn is back to doing the things she loves.
I'm able to actually go out and enjoy myself more pick up my paintbrush again. I love to paint.
Her recovery has taken about a month, compared to up to 3 months for the traditional surgery.
I could have had a scar that went from here to here, but based on this minimally invasive surgery, I only have a scar about 3 inches long, and it's under my arm, hardly visible at all.
The patient's ability to return to normal activity, again, very gratifying and very demonstrable. Now over 8 to 9 years and hundreds of patients, I can definitively say that their recovery, those patients undergoing minimally invasive approach, is certainly different.
New patients need a referral to the SSM Heart Institute's minimally invasive valve team. Dr. Teodoro encourages patients needing valve surgery to explore the minimally invasive approach.
So I would like to thank Dr. Teodoro and all of his staff. They were just wonderful.
If you have been recommended for heart valve surgery but would like a second opinion, call 314-647-8269 to schedule an appointment with Dr. David Teodoro or other SSM Heart Institute surgeons.